Welcome to the Healthcare Unfiltered Express, where I conduct short video interviews packed with relevant and timely information that you cannot miss. So sit back and enjoy the show. Jonathan, welcome to Healthcare Unfiltered Express. Really appreciate your time. I know it's chaotic and it's very busy for you, so I appreciate you always giving us a few minutes of your time. And I really wanted to chat with you about what we hear, that AI is always good for the mundane humanistic work that we can automate, but many people contest, rightfully or wrongfully, that AI cannot do complex decision making in clinical practice. When you're seeing a patient, there are certain elements of that that requires us, the humans, to think. Are we moving towards a scenario or a situation where AI could do this part of the physician job?
I mean, we're always moving towards things that are going to be beyond what we can even imagine. It's just kind of what's happening within the next few years and what's happening in the next 30 years. That's kind of a different issue. In the very near term, it's clear to like administrative paperwork type things are rapidly being taken over already. By the way, though, that's the optimistic view. The pessimistic view is people tend to create more paperwork when you do more paperwork too. So it's likely we'll still have even more demands created as supply is produced. In terms of complex medical decision making, you like to think, oh, well, sure, a computer can look up information, but I deal with open-ended, nuanced reasoning. Well, it turns out these emerging language models and multiple studies we've done, it's like they're actually pretty good at a lot of that too. Does that mean they can do it? Yeah, they can do it. They're not going to do it perfectly, but a lot of humans don't do a lot of that stuff perfectly either. And a lot of it's going to keep on advancing different ways. I still think the human is still very critical at this point because it's not just about like knowledge, it's not just about reasoning, it's like judgment. There can be two things that are true at the same time, but what should you do? Right? The patient has kidney failure and heart failure. Should you give the diuretics or not? That's not a question you look up in a textbook. So an AI doesn't answer that question for you either. It's like, well, is it worth the risk? I mean, these are the kinds of things that actually most of medicine is fraught with, having judgment about complex situations, which, by the way, still requires you to have knowledge. Otherwise, you don't know what you're reasoning and having judgment about.
So there's so many papers that show AI plus human is better than human alone. You've published some of that work,
Mhm.
and I think I'm pretty convinced in my research that AI plus human better than human alone. Are there papers looking at AI plus human is better than AI alone?
Sure. In many cases, that has been the case, and also AI is just a marketing buzzword, right? It's just whatever computers do today. So for decades, that has been the case. Diagnostic, decision support systems. The AI can't talk to you, can't get your history, it can't even get the information. But a human who collates information and puts it in and synthesizes it, wow, combined, it does better than both. And that really drives the whole mantra of this field, this fundamental theorem of informatics. Human plus computer, when combined, will deliver better results than either alone. Sounds so good and a very intuitive appeal. But now, for certain tasks, it's really weird. There are certain tasks that you could not have expected a computer to even try by itself before. But now that computers can sort of just like read by themselves, now that they can scan images by themselves, there have been many examples in like mammography, radiography, and now we and others, including the groups at Google, have shown even for complex medical diagnostic management reasoning, that's really weird. The AI by itself is doing as well or better than a human using that same AI tool, which begs this really uncomfortable question like, wait, what is a human doing here? Is the human just slowing the computer down? And maybe we should just get out of the way, let a calculator do the calculations and not try to interject ourselves. I think it's way more complex and nuanced than that, but we have to ask this very uncomfortable question about what's the right role for humans and computers in modern medicine.
You mentioned something that, what's going to happen in 2 years, but what could happen in 20 years? Where do you think we will be in 20 years?
I don't know. Why even bother trying to guess? I can make up things. Just watch your latest, science fiction Star Trek show, and maybe you'll be close. Because I often tell people, like, can you remember what your life was like 20, 30 years ago? Try to imagine yourself from 30 years ago and was able to time travel and look at yourself today. You perform like literal magic every day. You can like look up anything on the internet you want. You get auto navigation. You can just talk to computers and they talk back to you. You can automatically scan and tell if it's a cat or a dog, an image. This would have seemed like absolute magic 20, 30 years. It would seem impossible. So the reality is 20, 30 years from the future, I think we actually have a very hard time imagining because it will become commonplace what right now seems impossible.
My last question to you is actually pretty simple. If I'm faced with a patient, or you're faced with a patient in the hospital, you're a hospitalist, and
Mhm.
seeing that patient and you're trying to make a decision, give me one good reason why not to add AI, whatever your search engine that is, into your decision making.
I'm not sure there is a good reason not to. It'd be like, give me one good reason not to use the internet to help you when you're doing medical care. It's like, why wouldn't you do that? There is a balance of, and right now there's a very limited a human attention span, right? So there's a real automation bias, and there's real alert fatigue phenomena in clinical practice, right? Every tech person's got to think, doctor, just pay attention to my alert. I got more information. I'm going to give more information to the patient and doctor so then you can make better decisions. Like, dude, I literally have hundreds of messages I respond to every day. I have 50 pages of documentation. I don't need more information. There's no way I can process what's in front of me already. So, for this very straightforward case of a urinary tract infection sepsis, I have a very good mental model already. I already have a good protocol. It will actually be a distraction for me to like chat with AI for a while about it. That's not the good use of time. For the very complex, he's like, man, I don't know what's going on, and I feel like I might be missing something. I need some help to kind of think it through. That could be a very useful resource. But injecting technology in places where it's not needed will actually impede processes and add more bloat and inefficiency rather than what you were actually looking for was gains.
Dr. Jonathan Chen, thank you so much for visiting with me. Thank you for listening to this edition of the Healthcare Unfiltered Express. Until next time, take care.